A revision facelift is basically what it says, you're revising a facelift. So it means somebody has had a facelift and they're not happy with the results that they have. And so a revision facelift is a little harder than a regular facelift because you're going in and repairing the facelift and make a better secondary facelift. There are many factors that go into a revision facelift. The first thing I always like to do is to work on natural healing the best we can. If there are concerns with exposure and infection and severe asymmetry, we might intervene earlier. But typically we like to wait a minimum of about 6 months, usually preferably 1 year, before a revision facelift. There are many factors that have to do with the success of a facelift. Number one is probably experience. Number two is the approach. A lot of people do a superficial approach. My approach is a deep approach, and it's from the inside to the outside. Most people go from the outside to the inside, which causes more scarring, more swelling, more problems. So it's important to go with someone that has experience and has the proper modern approach. A bad facelift can be turned into a good facelift, but possibly not a great facelift, depending on how much damage was done. You always want to get it done correctly the first time. That's why it's important to shop around and make sure you go to someone with a lot of experience. 60% of my practice is revision, or what I call rescue surgery. So I do work on a lot of patients that have had less than optimal outcomes, and I can always help them and I can get them back to where they're happy, but certainly I can't assure them that I'll give them the best result that I could have if I did their surgery to start with. Please make sure to subscribe. A well done facelift should last 10 to as long as 15 years. Certainly you can have another facelift after your first facelift. Most people during their lifetime, if they start early, will have 2 facelifts and maybe even a third tweak of some sort. But the thing about aging is we can turn you back on the timeline, but we can't stop it. So when you're 100, you only look 85. You always get the benefit. When we talk about risk with facelift surgery, a revision facelift has some unknowns that make it more challenging. That's why it's very important to go with someone that has a lot of experience. You're depending on normal anatomy and what are called tissue planes. And when you do the surgery and you're going into altered tissue that possibly wasn't done properly, you're going to encounter more scar tissue. So make sure that you go to somebody very experienced, especially if you're having a revision facelift. When you have a facelift, the best thing to do is to get through what I call the frustration phase and get to where everything's healed. If you're not happy, and especially if you're having any kind of problems like dry eyes, tearing, pulled down areas, excessive scarring, you should consider a revision facelift. A revision facelift done correctly can correct many, or if not all, of the challenges that you had with a poor original facelift. A facelift can always be redone and improved, but the best thing to do is to have it done right the first time. So if you feel like you got into a situation and you need to have an improvement, talk to somebody very experienced. They can help you, but ideally you want to do all your research and homework and do it right the first time. A facelift can always be tweaked depending on what the concerns are. I like to tell people that 95% of everything that's needed gets taken care of, and there is always 5% where they could have a concern. As an example, I saw a gentleman that he had a facelift and his eyes done 2 years ago, and one of his lids had loosened a little bit, and so we tightened it with one stitch in the office, and it took 15 minutes, local anesthesia. So there's always little, what I call sneaky tweaks that we can do. A second facelift, if the first facelift is done correctly, is not more complicated. But if a second facelift is a revision facelift because of a poor outcome and scar tissue in areas that shouldn't have occurred, then it certainly is more challenging and does have the potential for more complications.